Okay, let's talk about all kind of abnormal scenarios in JVP. So the first thing is CP steep XY, CT no Y, and TR no X. This is the most important part, but let's talk about the entirety. Large A wave in JVP, one of the most important questions. So when it happens in kind of stenosis, if this is my heart, so if this is the heart, we have tricuspid valve in this part. If we have stenosis here, then the atria must generate more power, and obviously the A wave will go much higher. So large A in tricuspid stenosis, most important. Same goes for pulmonary stenosis here as well. Pulmonary stenosis, PS, TS. More power is generated to push the blood out, and that's why we have more higher A. Next comes in pulmonary artery hypertension. Because of hypertension, more resistance, so more power is generated, more push out. We have here, instead of writing PAH, they will write two other words, that is scleroderma or Eisenmenger syndrome or disease or complication in Bachcha party. No, not in Bachcha party. We have also tetralogy of Fallot. In Bachchas. Okay. We have another condition, that is mitral stenosis. In case of any JVP related question, we can rule out the left chamber part, that is mitral stenosis, regurgitation or anything, or atrial, anything regarding to atria or mitral. But in long standing mitral stenosis, we have a narrow part, so blood is pushed inside this. Some part of the blood is still remaining here, that causes congestion. This congestion is forwarded up to the lungs, and after lungs, obviously it will be passed down. Pleural edema will be there, pleural edema. Obviously it will be then passed down to right chamber, and after this thing will obviously happen. This is written here as well. Right ventricular hypertrophy will be caused, higher power and high A waves. Next, when we'll have absent A, in case of atrial fibrillation, because the heart is not properly pumping, it is just twitching like this. So in atrial fibrillation, irregular pulse will be written in question, and no power due to in atria, so no A wave, no A in atrial twitching or fibrillation. Atrial fibrillation is most common sustained arrhythmia in clinical practice. So arrhythmia is, first thing is atrial fibrillation. P wave is absent in atrial fibrillation. A wave is absent in atrial fibrillation. P wave in ECG and A wave in JVP. S4 is absent in fibrillation, that is in auscultation. Next is giant A wave when frog sign. It is seen when the AV dissociation is occurred. That means first the atria contracts, then the ventricle contracts. If this dissociation is AV dissociation is occurred, both of them are occurring at the same time, causing a giant A wave. Both of the chambers both of them occurring simultaneously, that is causing a giant A wave. Giant A is equal to canon A. It is also known as frog sign. Canon A is seen in ventricular tachycardia and junctional tachycardia. In junctional tachycardia, I have a negative P wave in ECG. Negative P wave in ECG are also common in complete heart block or third degree heart block, that is also known as Stokes-Adams syndrome. Okay, this is written in here. What happens in complete heart block or third degree heart block? Okay, this picture is of this part. Absent X descent, that is tricuspid regurgitation. Let's talk about what happens in tricuspid regurgitation. We have seen this thing in severe tricuspid regurgitation. CB wave or steep Y descent along with absent X descent is seen. So what happens here, this part as well, same picture. Absent X, steep Y, and prominent V or CV wave. It is seen where tricuspid regurgitation. What happens if this is my heart chamber? When tricuspid regurgitation means the blood is flowing out of this part during ventricular systole. Along with going out, the blood is also going inside. So obviously, if the water column, blood column is this, in X descent, it should be come down due to ventricular systole, but instead of coming down, more blood is coming inside the atria. So instead of coming down, it goes up. And in severe tricuspid regurgitation, it goes very up. Okay, it's easy now. The wave comes, the atrial systole is this, then after C, it should come down like this, but instead of coming down like this, as it goes up in ventricular systole, the blood comes out of the heart, it should come like this, but কারণ ব্লাড এখানে উল্টে এট্রিয়াতে জমা হচ্ছে, the curve goes like this. Okay, and then it comes steeply down during rapid filling part, that is Y. So we have this CV wave. Okay, this is the case. Now next case is absent Y. Absent Y. Y means what? Y is happening during diastole. Okay, rapid in diastole we are having rapid ventricular filling, that is in diastasis. So absent Y means absent diastasis. Diastasis. জানি না। In absent diastasis, what we are having, it is seen in cardiac tamponade. So if this is my heart and due to any trauma, hematoma or anything, fluid is accumulated around it, so it cannot properly stretch. If it cannot properly stretch, that means in no diastole, then obviously blood cannot come and fill inside because it is getting pressured. If little bit amount of water is present, we have in low pressure cardiac tamponade and obviously high pressure cardiac tamponade, that is just called as cardiac tamponade. In low pressure, the arteries are just squeezed already, চুপসে গেছে, so there is no amount of blood in artery atria, that is 30 ml, but the rest is all right. The rest we have blood and it can properly go out as well. So only in question we have the word that is BP is less because of diastolic collapse of right atria, whereas in cardiac tamponade, that is high pressure cardiac tamponade, we have much more fluid. All of it are going to pressurize the ventricle as well the atria, so no blood is coming inside properly, so BP, no blood is going out as well, so BP is not seen, and it is in question, it will be written as diastolic collapse of ventricles. In question, the BP is not seen, it will be written as pulsus paradoxus. Heart, it means heart is beating pulse is not there but heart is beating. If pulse is not there, heart is not beating, it is a cardiac arrest, but here heart is beating but pulse is not present. So this is the scenario, it is just written here. This is the pulsus paradoxus. Pulse disappears, pulse পাচ্ছি না কিন্তু হার্ট বিট করছে, not cardiac arrest. Pulsus paradoxus is checked in normal breathing. পেশেন্টকে জাস্ট নর্মালি ব্রিথ করতে বলবো. Pulseless electrical activity, here in pulse is very low, S1 S2 is muffled because so much water is around it, water, and Y descent is absent. So what is the reverse Barnum effect when it is called pulsus paradoxus and when it is not? Proper definition: in inspiration and expiration there is a difference between the systolic blood pressure. and it is not more than 10 millimeter Hg. Example is systolic blood pressure in inspiration 115 by 80 and 120 by 80. It is a normal difference. If it is more than 12, then it is called pulsus paradoxus. That's it. So this is the entirety of large A wave is seen is pulmonary artery hypertension absent in atrial fibrillation, super large wave in twitching, that is ventricular or junctional tachycardia. Sorry, absent is in atrial fibrillation, that is twitching. Third degree heart block. Okay. Absent X is present in TR. We have TR, absent X, prominent V, and CV and steep Y. CV, steep Y in TR. Absent CY is cardiac tamponade. Absent Y, steep X in cardiac tamponade as well. Kushmal sign in CP, RCV, RVF, that is constructive pericarditis, complication of TB, restrictive cardiomyopathy, that is fibrosis, and right ventricular failure, that can be written as inferior wall MI, pulmonary embolism, or COPD, or acute core pulmonale, or core pulmonale. And next is type X, type Y in constructive pericarditis. That's it.